Hello, my name is Helena Herklots and I'm the Older People's Commissioner for Wales. As we grow older, it's important that we are able to age well. In other words, that we don't just add years to our life, but we're able to add life to our years. And that means fundamentally, across society, changing the way we think and feel and act towards age and aging. Not seeing it as a period of decline and dependency, but understanding all the opportunities that growing older can and does offer us. But in order for that to be a reality, there are a number of things that need to happen. First of all, we need to make sure that we tackle ageism, the discrimination that exists against us because of our age. The World Health Organization, in their assessment, find that 1 in 2 people worldwide hold ageist views against older people. In other words, prejudice, stereotypes. And these are damaging. They are damaging to our physical health and they are damaging to our mental health. So in order to make sure that we can enjoy our later years, that we can feel included, we can feel valued, we need to do all we can to tackle ageism and age discrimination in how we think and feel and act, and also in how we develop policy, how we provide services to make sure they are inclusive of all ages and inclusive of older people in all their diversity. At local level, we need to make sure that if we need support as we get older, it is there for us. And we need to make sure that the barriers that can get in the way of us aging well are removed. And one of the ways in which we can do that is to make sure that our communities are age friendly. In other words, they enable us to get out and about and do the things that matter to us. Communities which make us feel valued, not ignored, which give us an opportunity to take part, whether that's through volunteering or being able to carry on with the things that we've enjoyed throughout our lives. And here in Wales now, we are now developing age-friendly communities across the country and joining in as part of the international and global network of age-friendly communities and cities. To ensure that we've got that local support, of course, means investing in local services, things that older people can get to, and things that are available whether or not we're online. It's important that in developing services that support our mental health and well-being, we make sure that we're not excluding people who are not online. So we know that over 30% of people over the age of 75 have no access to the internet. So we need to make sure there's a range of services available. And crucially, that there's ongoing and sustained investment in the voluntary and community sector who do so much to support our mental health as we get older. And there's some fantastic examples across Wales of projects and services that do that, from men's sheds to walking groups, for example, to opportunities for volunteering, to sharing our skills with other generations. And if we need services that the NHS is there to provide for us, we need to make sure that our needs are judged not on the basis of our age, but actually on what we need. So we need to make sure that there is no age discrimination in the way that mental health services are developed and provided. People have experienced isolation and loneliness, particularly during the years of the pandemic. But for many older people, it's something they've been living with for many years. So in our work to develop age-friendly communities, we need to make sure that older people are not having their lives blighted by loneliness and isolation. And the organisations and community groups that do so much to support older people need to know that they have the sustained investment that they need to carry on that great work. We know that the impact of loneliness and isolation can be severe on our physical health as well as our mental health. And we need to make sure that no one feels isolated or cut off, and that we reach out to people across the generations who might be experiencing loneliness at a time when they're dealing with so much in the cost of living crisis. We have a great opportunity now with the new Together for Mental Health strategy, and also linking in with colleagues across the world as we are now in the United Nations decade of healthy aging. And fundamentally, we need to make sure that as we go forward, we make sure that older people are valued, rights are upheld, and no one is left behind.